A 71-year-old man died peacefully in his sleep last night. His family was stunned. He appeared healthy the day before, no major illnesses, just a normal evening. Yet the next morning, he didn't wake up. What happened? Could it have been prevented? After age 70, certain bedtime habits silently increase health risks. These habits raise the likelihood of serious events like strokes, heart attacks, and sudden death. Most people don't realize they're making these mistakes. This text analyzes 4 nighttime habits to avoid if you're over 70. These habits may seem minor or familiar, but have profound effects on health and longevity. Some might surprise you. Others may be long-standing routines. By understanding these habits, you can protect yourself, improve sleep quality, and wake up feeling stronger and healthier every day. The last habit is especially common and dangerous for seniors. Number 1. Eating heavy meals too late at night after the age of 70. The way the body handles food changes drastically. Metabolism slows, digestive enzymes reduce in effectiveness, and the coordination between stomach, intestines, and other organs deteriorates compared to younger years. Eating large or heavy meals too close to bedtime places a significant strain on these already weakened systems. This habit, common and often overlooked, silently raises the risk of multiple nighttime health complications such as acid reflux, disturbed sleep patterns, elevated blood pressure, and serious cardiovascular events including heart attacks and strokes. When food enters the stomach, the body initiates a complex digestive process requiring energy and physiological resources. Normally, the digestive system works efficiently, breaking down food into nutrients, absorbing them, and expelling waste without major disruption to other bodily functions. However, after 70, the slowed metabolism means this process takes longer, and the body's ability to coordinate digestive actions during sleep is impaired. Late-night heavy meals force the digestive system to remain active during hours when the body should prioritize restorative sleep, creating physiological conflict. This conflict manifests primarily in 2 ways. First, the production of gastric acid continues or even increases while lying down, causing acid reflux. The lower esophageal sphincter, a valve that normally keeps stomach acid from rising, weakens with age. When lying flat or reclining soon after eating, acid can escape into the esophagus, leading to discomfort, burning sensations, and disrupted sleep due to coughing or choking reflexes. Over time, this chronic acid reflux, known medically as gastroesophageal reflux disease, damages the esophageal lining and can impair the muscles around the throat and airway. This increases the risk of aspiration pneumonia, a severe lung infection caused by inhaling stomach contents, which is particularly dangerous for seniors with weakened immune systems. Second, the digestive process keeps the sympathetic nervous system, the part responsible for fight or flight responses, active when it should be quiet during sleep. This means the heart rate remains elevated, blood pressure stays higher, and the body cannot fully relax. This increased cardiovascular load overnight raises the risk of sudden heart attacks or strokes during sleep, which often go unnoticed until it's too late. The brain also fails to enter the deep restorative stages of sleep, impairing memory consolidation, immune function, and cellular repair processes critical to aging bodies. Beyond acid reflux and cardiovascular strain, late heavy meals can cause blood sugar spikes. Older adults, especially those with diabetes or prediabetes, experience greater glucose level fluctuations after eating. The pancreas insulin response declines with age, and combined with slowed metabolism, high blood sugar can remain elevated throughout the night. This increases oxidative stress and inflammation, both linked to chronic diseases such as heart disease, kidney failure, and nerve damage. Empirical research supports these dangers. Studies show that seniors eating large dinners within a few hours of bedtime are more likely to suffer from nocturnal hypertension, sleep apnea, and other metabolic disorders. These conditions cumulatively increase mortality risk over time. Practical recommendations include finishing the last full meal at least 3 to 4 hours before sleep. This allows sufficient digestion and prevents the stomach from working overtime during rest. If hunger strikes late, light, easy-to-digest snacks like a small handful of nuts, a piece of fruit, or a cup of warm herbal tea are advisable. These choices support blood sugar stability and don't trigger excess acid production. Understanding that the body's digestive efficiency changes after 70 is key to preventing these risks. This knowledge demands reevaluation of lifelong eating habits. Avoiding heavy meals late isn't a minor lifestyle tweak, but a critical intervention for health preservation and longevity. Seniors should consider meal timing as seriously as food quality, since when you eat can matter as much as what you eat. Number 2. Drinking too much liquid before bed. Hydration is essential for health, but excessive fluid intake right before bedtime becomes problematic after 70. Aging causes physiological changes in the urinary and cardiovascular systems that make nocturnal fluid consumption a risk factor for disrupted sleep, falls, and cognitive decline. The bladder's capacity and muscle tone diminish with age. It cannot hold urine as efficiently, and the sensation of urgency occurs with less volume. Meanwhile, kidney function alters. Filtration rates slow but often continue producing urine steadily throughout the night. Combined, these factors mean fluids consumed in the evening cause frequent nighttime urination, known medically as nocturia. Nocturia has consequences beyond inconvenience. Each awakening interrupts the sleep cycle, especially the critical deep REM stages responsible for cognitive function and physical restoration. Waking and exposure to light inhibit melatonin production, the hormone that regulates sleep-wake cycles, making it harder to fall back asleep. This fragmented sleep pattern weakens immune response, raises systemic inflammation, and accelerates brain aging. More seriously, frequent nighttime trips to the bathroom elevate the risk of falls, a major cause of morbidity and mortality in older adults. Seniors often experience postural hypotension upon standing, an abrupt blood pressure drop that causes dizziness or fainting. In the dark, disoriented, and possibly impaired by medications or reduced muscle strength, they are vulnerable to dangerous falls resulting in fractures, head trauma, or worse. Long-term nocturia and sleep disruption also increase cardiovascular risk. Poor sleep quality correlates with hypertension, arrhythmias, and increased arterial stiffness. Studies indicate seniors with fragmented sleep have higher rates of dementia and other neurodegenerative conditions. The relationship between sleep and cognitive health is bidirectional. Disrupted sleep exacerbates memory loss and brain function decline. Hydration strategy must therefore adapt. The majority of daily fluid intake should occur earlier, tapering off by late afternoon. Small sips may be taken if thirst arises in the evening, avoiding large volumes at once. Avoid caffeine and alcohol in the late day, as caffeine is a diuretic and alcohol disrupts sleep architecture. Furthermore, hidden fluid sources require attention. Many medications, soups, high-water fruits, and vegetables contribute to overall fluid balance. Adjusting intake holistically reduces nocturia without risking dehydration. Monitoring urinary frequency and sleep patterns helps seniors identify problematic habits. Consulting healthcare providers for persistent nocturia or nighttime dizziness is crucial to rule out underlying conditions such as urinary tract infections, prostate enlargement, or heart failure. This approach balances hydration with safety, reducing falls, improving sleep quality, and protecting cognitive health. It exemplifies how small routine changes mitigate large health risks in aging populations. Number 3. Sleeping in a room that's too warm. Temperature regulation deteriorates with age due to changes in skin, sweat glands, and circulation. Seniors have diminished ability to dissipate heat, making them vulnerable to overheating during sleep. Sleeping in a room that is too warm is a hidden hazard that increases cardiovascular strain, causes dehydration, and disrupts restorative sleep cycles. Normal core body temperature naturally decreases during sleep, facilitating metabolic slowdown and entry into deep sleep phases. Warm environments inhibit this cooling process, forcing the heart to work harder to regulate body temperature. This cardiovascular strain elevates risk of heart attacks and strokes, especially for seniors with pre-existing conditions. Moreover, warm sleeping conditions promote sweating, which leads to fluid loss and thickened blood. Dehydration at night can be subtle but dangerous, increasing blood viscosity and the likelihood of clot formation. Sleep quality is also severely compromised. Elevated body temperature reduces REM and slow-wave sleep, both critical for memory consolidation, immune function, and tissue repair. Seniors sleeping in warm rooms report restless nights, frequent awakenings, and morning grogginess. Maintaining a cooler bedroom environment supports natural thermoregulation. Layering breathable cotton blankets instead of heavy synthetics aids heat dissipation. Wearing light moisture-wicking pajamas helps maintain stable skin temperature. Opening windows or using fans encourages airflow. And fresh air circulation, also improving indoor air quality, reducing respiratory irritants that disturb sleep. Case studies show seniors who optimize bedroom temperature experience fewer cardiovascular events and improve subjective sleep quality. These benefits translate into enhanced daytime cognitive function and physical well-being. Adjusting environmental factors is a low-cost, high-impact intervention that seniors often overlook. It requires awareness and experimentation to find personal comfort zones within recommended temperature ranges. Number 4. Sleeping in the wrong position. Sleep position influences respiratory function, circulation, and musculoskeletal health. After 70, muscle tone weakens, lung capacity diminishes, and blood vessels become more fragile. Incorrect sleep posture magnifies these issues, increasing risks of apnea, poor oxygenation, edema, and cardiac strain. Sleeping on the back causes the tongue and soft tissues to collapse into the airway, obstructing airflow and leading to obstructive sleep apnea. OSA causes repeated breathing interruptions, hypoxia, and fragmented sleep. Untreated, it contributes to hypertension, arrhythmias, stroke, and sudden cardiac arrest. Many seniors unknowingly suffer from OSA, as symptoms are often attributed to aging. Side sleeping, especially on the left, improves blood flow by reducing pressure on the heart and major blood vessels. It facilitates efficient cardiac output and lymphatic drainage, reducing fluid buildup in lungs and extremities, thereby preventing congestive heart failure complications. Additionally, left-side sleeping reduces acid reflux by positioning the stomach below the esophagus, minimizing acid backflow. This improves sleep quality and decreases respiratory irritation caused by reflux. Supporting proper alignment is crucial. Use body pillows to prevent rolling onto the back. Elevate the head with a supportive pillow to keep airways open, and place a pillow between these to maintain spinal alignment and reduce joint pressure. Attention to sleep position can profoundly reduce cardiovascular and respiratory stress, improve oxygen saturation, and alleviate musculoskeletal discomfort. This results in better restorative sleep and overall health. Summary: each one reveals critical but often overlooked habits that silently endanger seniors. Awareness and targeted adjustments to meal timing, fluid intake, bedroom environment, and sleep position empower individuals to reclaim control over nighttime health. Implementing these changes systematically reduces risks of heart attacks, strokes, pneumonia, falls, cognitive decline, and poor sleep quality, ultimately extending health span and quality of life.